Hello, everybody. Welcome. I am Dr. Lauren Grauert. I'm an addiction psychiatrist with Kaiser Permanente and also the Chief of Psychiatry for Northern Virginia. And I'm happy to have with me today Dr. Humaira Siddiqui, who is a medical director and an interventional psychiatrist here with us at Kaiser. We are really excited to be here to talk about something that I think has been on everybody's mind, and that's COVID and mental health, and particularly how COVID has had impacts on mental health, the short and long-term consequences, the daily life consequences, and just some quick tips that you can take away on what you might be able to do differently to help cope through these difficult circumstances. So we're really happy to talk today, hoping we get some questions as well. And, I think what's on a lot of people's mind now is the increase in depression and anxiety symptoms that we're seeing with isolation. And so to kick us off, I wonder, Dr. Siddiqui, if you could talk a little bit more about depression and anxiety. What are some common symptoms and warning signs people can look out for? And when should they know to seek help and get further care on that?
These are great questions. And I think I'm going to start with the tail end of your question is when should people know? So it's important to level set. In a normal year, in the autumn and in the winter, it typically brings about some very normal biological changes. If you grow a vegetable garden, if you look at the trees around you, if you see what animals are doing, they're going into a hibernative state, things are slowing down, trees are winding down, plants are not blooming as much, and that is very normal. As creatures of this planet, we have evolved with the seasons, and so we will naturally feel like we are slowing down too. That is very normal. Not optimal, but very normal. And one of the things to think about is that, when bears do this, we call this hibernation, but when humans do this, we have a tendency to think that there's a flaw, that there's something wrong with us, and really it's not. So the autumn is normal to feel a little bit more anxiety, and a little bit of sort of low energy, not being able to get things done. However, when something starts to shift, here are two things that I look at. One is the mood. If you're noticing that your mood is markedly different than what it normally would be this time of year, if you're noticing that you're a snapping turtle, that you're much more easily irritable, and because perhaps you're irritable, you might lash out, you might feel very upset, and then you feel an excessive amount of guilt. This is all coupled with, of course, marked low drops in energy. You're noticing that your self-care is not there the way that it should be around this time of year. I think that's really important to look at. And so we call that anhedonia, meaning I really can't anchor myself in things that I like to do, that I normally would do, or it evaporates very quickly. And that's really what depression is. Anxiety is also something that is very normal. It's a stress response, as is depression. We're conditioned to respond to stress. And so when we don't listen to our mind, our body starts to speak for it. It starts to go into low power mode, just like your iPhone, just like any of your smart devices. And so when your battery power is low, if you've got 20 apps running on it, I can tell you those apps are just not going to operate efficiently. Anxiety is a state of being hyper realistic. It's where we really can't shut things off. Even when we know how to process things, we know logically that these are not severe problems. Now everything feels like it's much more intensely experienced. And so depression and anxiety, while they are stress responses, they're normal. When they escalate and they elevate to a level where we're really not functioning the way that we normally would be at this time of year, that's when you seek help. So I know, Dr. Grauert, you and I talk about what are some of the things that we can do to help people kind of cope through it. And there's different levels of kind of noticing things. One of it is take an emotional inventory. You've got to take an emotional inventory, but you've also got to take a physical inventory. Have your habits changed? Are you doing the things that are part of a routine? Kindergartners love routines. So do grown-ups. Our routines have been markedly disrupted, but for many reasons that we're going to go into a little bit later. But taking that physical inventory, are you eating your meals on time? Are you kind of getting distracted with work? Are they nutritional? Are you doing what's called therapeutic movement? I'm not even going to use the word exercise. I'm going to say therapeutically, are you getting up and are you moving around? Or are you finding yourself kind of stuck in one position? Those things are things that can actually impact how you feel and how you experience stress, because your stress responses are going to change. Are you sleeping and getting up at the same time? Again, these are all about routines. And so what do you do? First thing to do is help yourself. Help yourself first by getting back into those routines that you know are so important for your mental health, but also your physical health. Uh, but let's say you have been trying that and it's not working, or you're feeling so badly that you can't get out of bed. You've really lost track of time. I hear a lot of folks tell me this. I've lost track of time. I feel like I can't get anything done. And that's where you want to start to talk about, are there problems happening? Are there things precipitating it? You may not be able to change everything that's going on around you, but what you can do is fortify your internal stress responses. That may be talking to a therapist, maybe coping through, working through a specific stressor, or it may include sometimes medication. I know, Dr. Robert, you talk a lot about medication, and so do I, but we also talk about skills before pills. So develop those skills. But one of the things I'm also seeing during the pandemic is people are sometimes self-medicating, and they're self-medicating that if you're feeling depressed, one of the things that's going to make your depression worse, even though you think it might make you feel better in the moment, is ingesting things that are going to depress you more. Things such as alcohol. I know that folks will sometimes use cannabis, and while these things may feel good in the moment, they're actually going to, let's just say, turn the tide the direction that you don't want it to go into. So those are some of the things that you can think about doing when you're thinking about just overview, a high level view of how do you sort of recognize the signs and symptoms, but also what are the initial things that you can do to start to get yourself out of that rut. Yeah.
And I know you mentioned some signs and symptoms. I often hear family and friends say that their loved ones will bring up changes in
Yeah.
themselves
Yeah.
before they actually notice. Have you seen that as well, or can you talk more about other people commenting on
Sure.
affect and mood changes?
Yeah, yeah. So sometimes I'll hear a patient come into my office and they'll say, "I'm here because my partner says that I'm more snappy lately, or that I'm not able to do things." And so it's always someone else that has brought it to their attention. And the good news is that if you have someone in your life that is actually bringing that up to your attention, you are cared for. That is a good thing. That is a gift, because someone cares enough about you to say, "Hey, I know that this is not you. I really want you to feel better. I want you to get better." And that's kind of one of the first signs, is someone else is going to notice it. We tend to be very brave. We want to be self-sufficient, and sometimes being self-sufficient can not work in your favor, because you may not realize that when do you ask for help? And it's often other folks that will give you that permission by letting on about getting help, about seeking something that they'll probably start off with, "Hey, maybe you should try this activity or try that activity, or maybe I'll take some of the burden off of you." But even when all of those interventions from loved ones take place, and it sometimes can feel a little bit like criticism, but try not to take it that way. Try to take it as a gift. Then yes, I find that it's usually someone else has said, my partner says I'm not behaving myself, or I'm angry, or I'm snappy, because it's really hard for them to kind of accept it in themselves. So it gives permission for them to come and see a professional. So yeah, absolutely. And Dr. Grauer, one of the things that I'm going to touch upon, I sort of touched upon earlier, was as we are at home and we're more isolated, I do notice that more patients are struggling with the early signs of what could turn into addiction. A lot of folks will consume more alcohol, and it may be something that they normally enjoyed. A glass of wine with dinner, it could have been a normal thing, but now they're having a glass of wine with their lunch. Maybe their day is ending a little bit early, and so they're consuming more. And folks are telling me, "I actually know this is not healthy for me. I know this is not what I want to do, but I can't seem to figure out, why do I keep picking up that glass of wine? Why am I ending my day earlier and earlier?" As an addiction specialist, are you seeing that in patients that are coming into your office, or are you starting to see patients who normally you wouldn't see in a year outside of the year of the pandemic? I think we've got a little bit of a delay there with the video. But I can tell you that Dr. Grover, you can probably share some information on what are some of those early signs that you're noticing with some of our patients.
Yeah, absolutely. I think that's a great point. The point you're making that COVID has made folks very vulnerable to increase in substance use and even potentially substance abuse. COVID, I think, is kind of a recipe for vulnerability for relapse because, as you said, people are more isolated. They have more free time. They're not driving from place to place. They're doing more virtual, which is easier to grab drinks or other things. So I have had a lot of patients tell me that they have noticed their consumption of alcohol or other substances going up as a consequence of the lifestyle changes that have come along with COVID. And to that, so the next point would be, okay, if COVID is making folks more vulnerable to addiction or misuse, what do we do to combat that? And I think the first thing is realizing in yourself or in someone else that you're noticing an unhealthy pattern of intake. And after you realize it, for some folks, it's a simple fix. For some folks, it's saying, I need to be busier with my days. I need to structure my days so that I'm not having as much downtime. I need to not give myself access to alcohol, keep it out of the house. I need to have a conversation with my family or loved one to be kind of honest about it. And then if those simple things have not worked, or if folks really realize that there's some significant impairment, certainly seeking help from a professional. Here at Kaiser Permanente, we have addiction therapist, addiction psychiatrist, and also being particularly mindful of holiday events where there might be alcohol or other substances around. That is actually one of the gifts, I would say, of COVID, is that things are more virtual. So, hopefully if someone's struggling with alcohol, they won't be around the wine at Thanksgiving or the beer at Christmas or the extra glass at Hanukkah. But I think if as long as you know that, it's very important to try to be mindful of those vulnerable situations. We like to say in addiction, don't go into a barbershop unless you want to get a haircut, or stay away from bees. If you're allergic to bees, stay away from beekeepers. You're allergic to them. And so just removing yourself from that vulnerable situation and taking advantage of something like virtual when there could be alcohol or other substances around as well. The other thing I want to mention is that SAMHSA, which is the Substance Abuse and Mental Health Administration, has a great toll-free number for anyone who's concerned about addiction, who wants referral information, or just some general advice. And the toll-free number is manned 24/7. It's manned by professionals. So in addiction, there's always a concern, is this place legitimate? Am I really going to get help, or am I going to go swim in a pool for 5 days? And so the people that man the website really give credible information, and it's also available in Spanish. And the number is 1-800-662-HELP, HELP. Or for those who only have cell phones these days, I think the help comes out to 4357. But I really encourage folks to use the SAMHSA line if they have questions or concerns. There's also some great digital therapeutic apps you can download on your phone that have a lot of resources for addiction. If you don't want to take that first step with talking to a professional, my favorite two for addiction are Calm and MyStrength. Those two Calm has a great class called Breaking Bad Habits. MyStrength is another one that actually even breaks it down into type of substance. So if you're struggling with alcohol, they have an alcohol curriculum. If you're struggling with opioids, they have an opioid curriculum. There's a lot of what's called motivational treatment or motivational therapy on there, which is actually kind of the method of choice for treating addiction. So it's a great way, those two in particular, and there's others, to get help out there, if you're trying to get your feet in the water. The other one, I'll just say there's one called Sober Nation and Sober Grid on Facebook, which is kind of a virtual group of people supporting themselves. It's one of the largest in the country. And so that's another for our millennial watchers who love to be on Twitter and Facebook at the same time. Sober Nation and Sober Grid are also really great resources for addiction. At the same time, one thing I've been thinking about, Dr. Siddiqui, is the increase in work-life balance stress that many folks, particularly women, are feeling as they're trying to educate kids and work at home and cook meals. Can you talk a little bit about that and what you're seeing and what some helpful things for folks might be?
I can tell you that women are now becoming the main breadwinners of a household. And yet not a whole lot has changed with respect to the way we feel obligated to kind of make sure that the kids have their meals, that we get everything 100% done with our work, and that we are also very good partners to those that we're in relationships with. And now, for a lot of people, it is it's a very good relationship if you do have a partner that you're working with, and partners are trying very hard to kind of work together. But in particular, it's kind of an interesting time. It's a little challenging time. And so I actually wrote a blog about this, and it's really about keeping harmony in the home. And one of the first things I always say, take an inventory. What is the situation now? Because when we start to think about everything that I want, we're not looking at, but what do I have in the here and now? And so I always say that the first thing you should do is look at how are things changed. Know that your child had a school. They had their office, just like you had your office. And that teacher had 30 or 40 students in the classroom, and they were managing all of those kids. And so recognize that you do have to discuss with those members of your household, discuss a schedule. And if you're able to do things that are visual, remember that before we ever learned to use our words, the very first thing that we really learned to use was our mouth for feeling things, but really our eyes. And so visual cues predate language. So we could talk to our loved ones and say, I need this and I need that. But if you don't create that structure around you, it's going to be really, really, really challenging. So I say create the visual cues, recreate those schedules, convert the place where you live into new boundaries, and those boundaries can have time limits on it. So, if you want to come up with a schedule for the day, for example, mom has to be on a conference call. If you have a partner who's also working virtually from home, or even an older child who may be able to take a little time off, because I know that the middle school and the high school schedules now do afford for certain days that are virtual days and certain days that are not virtual days. See if you can sort of arrange your conferences around that, so that the older child might be able to watch a younger one, or the other partner can also contribute to that. See who has what quiet time. Your adolescent may need that quiet time too in order to study for a test, or perhaps take a test, which is virtual and online. But designate certain key areas of your home. Think about a train. If you've ever been on a train, there is a part of the car that you have a conversation there's a quiet car. There's a cafe car. So you may need to redefine the boundaries in your place of residence, so that those particular boundaries are respected, and that you put up posters up, put up visual cues. If you've got a schedule board, those are flying off the shelves right now at all the stores, because everyone needs to have a schedule, and if everyone can see everyone's schedule, then they can also respect not just those boundaries in an office, but those time boundaries, what we call temporal boundaries. From this time to this time, I'm on a conference call. From this time to this time, I say it myself when I work from home with patients. I'm with patients at this time. But also, there's also the other visual cue. And this is also defining the beginning and the end of your workday. I think that in this virtual world, we are increasing the amount of work we're doing kind of insidiously. We don't have rush hour to get us onto the road and get us in the office. And also, we don't have daycare sometimes for some of those kids, where we have to leave our place of work to pick up the children. So we tend to bleed into starting your day earlier, and most people are guilty of ending their day later, not putting defined boundaries. You have to do that, and not allow those things to be encroached upon, because remember that even during the day, you've got to set those breaks aside, not just for yourself, but for family members to be able to check in with you. You would do that at the workplace. You would tell folks, hey, listen, I'm free from this time to this time for a quick check-in or a meeting. You've got to do that at home. And so bringing that symbiotic relationship with the office and your home means following very similar kinds of rules and recognizing, just like at work, emergencies pop up. It's okay. At home, someone's going to just barge into your office. May not be an emergency for you, might be an emergency for them. Understand repetition isn't necessary. That's what teachers do. Teachers repeat themselves over and over again, and it becomes learned behavior. So you may have told your child once or twice, knock on the door before you enter. You may need to tell them a few more times, and that's perfectly fine. It's totally okay to do that. Another thing I tell parents is please dress the part. If you are wearing your pajamas when you walk into your office, your child will think that you're not at the office. So dress the part. If you visually have that cue, teachers don't show up to school wearing their pajamas. They will wear some type of professional attire. Let your child see that visual cue. In fact, your partner may seem to see that. I will sometimes wear scrubs, even if I'm at my virtual office at home, so that when my partner is at the door, he knows, hey, you know what? She's at work versus regular clothes where it doesn't give off that uniform that I'm at work or now it's time for me to be engaging in home activities. Honor those home activities. If you've decided that someone's going to cook dinner, let that person cook dinner. Don't try to micromanage. Try to be flexible with one another. And I also say that when you're giving direction to children, particularly for children, be very specific. What causes people to get in trouble is they generalize a task. I want all of you to do something. If you give a job to everybody, nobody does it. Be very specific with the task and make sure that it's an actionable task, that is something that the child can actually perform, but give them something to do just as you would give yourself something to do. So really what I'm teaching here is exactly what a preschool teacher would do. It actually works in the home environment and will keep everyone much more sane. If they define their spaces, they define their workstations, they keep reminding themselves about manners. Make sure that you're in your uniform if you're at work, but also defining when your day starts and when your day ends, and give the appropriate amount of time to your family so that they can have enough of you as well and you won't be feeling guilty and frustrated.
I really like that advice. I think your theme is we're having to make some changes in what our routine and definitions look like, but at the same time, while we're making changes, we have to keep some sort of routine and structure. And how does that look? What does that look like differently? I was laughing because you talked about putting up a sign, and I have a 13-year-old niece who's doing school right now, and her mother, my sister, is caring for a little baby and breastfeeding, and so she put up a big sign on her door that said, fully clothed people required to enter this room. I'm in school now. So she was very proactive to just about what you said about appropriate attire and the hours that she was in school. So I think all that makes a lot of sense, and not something we would think about normally because we're in very abnormal times.
And you know, none of these things are super expensive. I've got old bed sheets that I actually will now make little. I'll hang them up, and it'll create dividers. So some kids who, for example, have ADHD and they really struggle with being distracted by things around them, creating those trifold dividers. Some of them you can purchase at the stores, but some of these things you can actually do it yourself at home and create these dividers in the home so that the child can actually get some stuff done. But just remember to pull back that curtain, make sure that they're actually logged into their class, because they are kids. I'll hear from other clinicians, other colleagues of mine who they have little children that are working, that are at school, and they're at, that they're on their virtual appointments. And it's really cute because sometimes kids will think, well, no one's watching me, and they'll kind of step away and they'll want to play, and that's okay. That's okay to do that. And I think teachers understand that too. Teachers understand that really little people are going to need to get up. They're going to need to sit back down again. But just creating those dividers in the house, and honoring those protected spaces, but remembering when to take those curtains down and let the children see that as well. Let your partner see that. And spending time with your partner is also really key. I think people forget that they need to nurture those intimate relationships. And so if that means that you've got to have a date night or maybe a date day, a date breakfast, a date snack, whatever that may be, cherish those moments, but make sure you're defining it and you're setting that time aside so that you are engaging with your partner, because if partners are happy, they tend to work really well together. They're aligned, and then they know exactly what to do when it comes to when the kids start to triangulate and the kids don't know what to do. So happy partners make happy kids. And now I'm thinking about this, Dr. Grauert. You're mentioning harmony in the house, right? Having your niece over and having your sister kind of put up a adults only sign. I would say that some of my patients have concerns about safety during the pandemic. I know a lot of people are doing a lot of things with wearing their mask, meeting with neighbors, even as they've created pods in their neighborhoods where they trust their neighbors like family members. Again, this is a gift in a sense, but the holidays are coming up. And some people are going to be doing virtual celebrations, but not everyone will be doing virtual celebrations. So one of the things that comes up sometimes when folks come into my office is they say that, you know, how do you navigate the health and safety risks when you're safely socializing during the holidays? What are some of the tips that you give some of your patients?
Yeah, I think that's something that's on all of our minds, myself included, is how to safely navigate holidays this year under the circumstances of COVID. And to go back to women, I mean, women bear a lot of that responsibility, the organizing, the preparation. And so that kind of means we're making a lot of those decisions. And I think one thing to keep in mind is the incredible way this virus is different in different people. We call it virus heterogeneity. So meaning in one person, you might have a 19-year-old who does fine and has no symptoms, and a 50-year-old who has pretty catastrophic consequences. And it can be flip-flop too. And I think that's the scary part for folks is knowing, I could get this disease, but what is going to be the outcome? It's really hard to make an informed decision and a judgment call, not knowing what is really the expected outcome of the illness. And so keeping that in mind, that the virus manifests itself so differently in people, I think it's important to always remember that a virtual approach is the most cautious approach. If you have any concerns about your health or the health of others, or any thoughts, questions, the default should be virtual. That being said, I also, as a psychiatrist, want to respect that people have differing opinions on this. Some people do want to get together in person and have found safe ways to do that in smaller groups, in outdoor settings. And if you're going to do an in-person event, it's important to have expectations ahead of time. So to let your guests know, please wear a mask when you come, or make sure you wash your hands when you come in and before meals, on your invitation or when you're emailing or you're just talking casually. We're going to try to stay 6 feet apart. So virtual is definitely the safest approach. But if in-person is done, having those expectations ahead of time of what the safety procedures should look like, so that there's no confusion when people arrive and some people are doing different things and some people are doing another. I think it's going to be tough though, but the silver lining, I try to look for the good in everything, is that with all of the anxiety, we have a lot of folks who really don't like getting together in person. Social anxiety or social phobia is the most common anxiety. And so if virtual is done, it offers an opportunity to see people in a less stressful environment. So that's one silver lining for that.
I've actually seen that too. So I have patients who have a lot of social anxiety. They get very nervous around the holidays, and for them, this is a blessing in disguise. They actually say that having a smaller, more intimate group of people is easier for them versus like big crowds of people when they have to meet a lot of people, and it's hyper stimulating for them. So for those folks, this is a blessing in disguise. And keep in mind that this pandemic has been going on for such a long time now that I don't think anyone would be surprised or frankly, horrifically offended if you said, hey, listen, we're going to be respecting some social distancing. They might kind of put up a brow, they might smirk a little bit, but they're going to honor it. And so I think the most important thing is that if you do decide in your neighborhood that you want to create safety pods, and I know that lots of folks are starting to do that, but that folks are kind of honoring, if they're going to self-quarantine beforehand, but that they're also still keeping a distance. Lots of folks are actually enjoying outdoor get-togethers, that they'll get together in their backyard, they'll get together in their front yard. People are doing events even for as Halloween is approaching. Folks are creating tables in their front, and what they're doing is they're putting the candy on the tables. They're kind of distancing themselves. The kids will kind of someone will sort of have a scooper. They'll put the scooper in the bag, and so I think there's a lot of things that won't seem so dramatic as far as shifts or changes. Some of these things might actually be kind of beneficial as we minimize the number of folks that are sort of going into that social contact, and also just kind of adapting to a new normal. That this doesn't have to be something strange. It's just different, and you can still enjoy your holidays by just making a few tweaks and adaptations here and there. I think, Dr. Grauert, you're right that if folks want to wear a mask, just like the restaurant rules, you can remove it, have your seltzer, have your soda, enjoy what you're doing. And if you're going to be, in a conversation, just keep a little bit of a distance. And remember, social distancing does not have to mean social isolation. And I know that you've probably encountered that as well. How do you help explain to patients the difference? Because I think that they should know the difference, but what they're practicing is social isolation when really it's social distancing.
Yeah. So social distancing does not have to equal emotional distancing. And I think the best way, other than just reiterating that to somebody, is to try it out for yourself. A lot of people, and I can put myself in this category, were skeptical that I would be able to have the same kind of emotional experience and bonding, on a Zoom call, for instance, as in person. But the more you do it, the more surprising I think it is how much you can connect with people in a safe way. And so it's like anything else in life. I think it's, practice makes perfect. Practice will also kind of let you get more familiar with the benefits of social distancing without having emotional distancing. I think one thing along those, one more kind of final question for you that we would be remiss to not touch on is that we have an election next week.
Yes.
And a lot of people are telling me how much of a struggle this is in the setting of COVID.
Right.
What would you say to folks who want to spend time with friends and family around the holidays, but are unsure how to navigate that hot button topic of politics that is going to be very omnipresent in our lives for the next couple of weeks and months?
Now, I understand that in some families, when they get together and they share a meal, they like robust conversations. And that is a very sort of family culture dependent kind of a thing. What I would also suggest is that one, understand what is the culture of your family. What is the culture of your dynamic? Do you want to have something that is going to be charged with political conversations? And if you do, this question is not for you. But for those of you who feel like, I want the really holidays to be about coming together, about family. I want it to be about friends. I want it to be about positive things, particularly if you're feeling stressed. And the last thing you want to talk about is yet the elections, or what the outcome of the elections is going to be. I always say, at least in my household, when one is in front of, when it's mealtime. Mealtime is kind of an important time because it really should be a time that folks have what I call tea time conversation. This may be a very Eastern thing, but you don't have conversations about politics or things that are uncomfortable during meal times. That is reserved for the after dinner conversation. But specifically during the meal times, when you've got a beautiful spread of food in front of you, or someone has gone out of their way to prepare something for you, or just getting together. I always say, if something's going to upset your digestion and your event is something that involves using your digestion, don't have conversations that are going to upset that. And so, you know who those members of your household are. You can either just send a general message to everyone in the family who may be coming over, whether that's in person or even in a virtual kind of setup. That tell people what the focus should be. Share with them that for this event, I would like for the focus to be about this, and call out the pink elephant in the room and say, hey, listen, I know that there's A, B, and C going on, but for this event, I would like the focus to be on us as a family, on what we've done during the year, how we've kind of come together, and keep it something where it's positive. And this may mean that you may need to be a director in the house, and if it can't be you, select someone else who can be that director, because you'll need help. You're always going to need help when you're navigating this. One person cannot manage an entire event, nor can you control everybody, but you can do a little bit of Haikido, where you can do a beautiful thing called redirection. So someone brings it up, and then someone else redirects it, and redirect it before it becomes an intense, involved discussion. And certainly, if you have friends and family who do that anyway, there's always, in every family, there's always that one person who's really good at it. You might want to assign that person the role. And if you're not sure about who that might be, again, we've got great psychotherapists who can teach you some amazing redirection techniques so that you can, sidestep a conversation, deflect, redirect, and keep it positive, so that the momentum is really nice and that you can actually enjoy your time together without worrying about that one thing, which is just going to be on the news everywhere. The other thing is,
Yeah.
some people like to turn the news on. I've noticed that in some households where they'll have a television running. You might want to put a little bit of a rule on there. No news, nothing that's going to be especially emotional or especially provocative. So that,
Yeah.
if you want to put an old movie on, the Nutcracker, whatever it may be, put something nice on television so that they're not bringing it up during the conversation.
Yeah.
Um,
I think that's great. Well, gosh, we've hit on a lot of important topics today that I think a lot of people out there and our patients are struggling with. We've talked about depression, anxiety. We've talked about homework balance. We've talked about addiction. We've talked about politics. I am really happy we were able to get together and do this and
mhm.
share this information. If you wanted to give maybe as a wrap up, what would be one takeaway, your biggest takeaway for folks listening today? Not to put you on the spot, but
Sure, sure. So this is my mantra for my life. This works for me, and I believe this has been something that's always helped me through everything that I've ever done that has been especially difficult or challenging and particularly unexpected. Um, you know, we all have expectations of what makes us feel good, makes us feel happy, makes us feel content, and sometimes those things don't quite pan out. And so, here's my gift to you, is that you can have everything you want in life, just not all at the same time. And so if you honor that, then you will develop already an innate patience for things that happen unexpectedly. You will be able to manage the disappointment of things that don't pan out the way that maybe you may have conceptualized or imagined it. But understand that if you always try, and you're persistent, but make sure you're pacing yourself and you're staying healthy about it, then truly, truly, you can experience everything that you want in life. Just try not to do it all at one time.
yeah, that's really poignant and beautiful, and I think good for Americans to hear in particular, and women. And
Hmm.
so thank you for that. Thank you for joining me today on Facebook Live, and I believe this is being recorded if folks want to watch later. We really hope this was helpful, and we look forward to talking again soon. And
Hmm.
have a safe, happy, restful holiday season from myself and Dr. Siddiqui.
Absolutely. Everyone, take care.
Take care.